Good day, sir.
Good day, nurse.
Okay, sir, I am Nurse Leia and I will be your nurse for today. May I know your name, sir?
My name is Leo Villena.
Okay, how would you like for me to address you?
You just call me Leo Boy.
Okay, sir, Leia boy, for today I'll be assessing your head, your face, and your neck, specifically your eyes, nose, mouth, and ears. Okay, sir?
Okay.
But before that, let me gather my equipment, wash my hands, apply gloves. So I'll be back for a minute. Okay, Sir Leo boy. Before we start, I just wanted to inform you that this assessment will involve me to ask several questions regarding your health history. And we also make sure that all of your information that will be given to me later will remain confidential. Okay, sir?
Okay.
Okay, now, sir, I'll be asking you questions. So, any family history of seizures,
No.
pain, itchiness in your head, any lumps or bumps?
No.
Okay, none. So, any dizziness? Do you experience dizziness or headache?
No.
Any head injury or do you have undergone head surgery?
No.
Okay, now, sir, I'll be inspecting your head. I'll be touching your head. Okay, as I can see, there's no presence of lumps and bumps. And there's no lesions. Okay, good. No lesions. So as I can see, your head size is normal. It's rounded and it's symmetrical. Okay, for your facial features, I can see this. Your facial features were good. Your palpebral features were equal in size, and your nasolabial folds were also equal in size. And okay, good. Your ears are symmetrical. Your nose is in midline. Okay, for your eyes, there's no presence of edema, any redness, inflammation. Okay, good. For your facial movements, can you raise and lower your eyebrows? Can you blink for me? Can you frown? Can you puff your cheeks? Okay, can you close your eyes tightly? And can you smile for me? Okay, good. So there's no involuntary movement of your facial movements, and there's no drooping of the eyelids, which is good. So now, sir, let's proceed to your eyes. So any family history of loss of eyesight?
No.
Okay, any tearing or blurry visions of your eyes?
None.
Okay, so any eye surgery?
None.
Do you use medication for your eyes?
No.
Do you use contact lenses?
No.
Okay, now, sir, I'll be inspecting your eyes. So as I can see, your eyebrows is evenly distributed. The hair of your eyebrows were evenly distributed. The skin were intact. And as you raise and lower your eyebrows a while ago, they were moving normally. And then for your eyelashes, I can see that your eyelashes is slightly curled outward and that the skin is intact also. And then for your eyelids, as you blink, they were bilaterally moving. And the skin were intact. There's no inflammation, redness, or any lesions on your eyelids. There's no drainage as well. Okay, good. So for your bulbar conjunctiva, they were white in color and there's no redness, inflammations, and lesions. Okay, good. Now I'll be checking your cornea. I'll be flashing light. Okay, just look straight ahead of me. Okay. Okay. So your cornea is normal. They were transparent and the details of your iris were visible. Okay, now for your pupils, I can see that your pupils were round. They were rounded, normal, and they were color black, and that they were equal in size. Okay, now, sir, I'll be checking your pupils' response to light. I'll be flashing light on your pupil. Just look straight ahead of me. You want to... Okay, the other one. Okay, so sir, as I can see, both of your eyes were constricting normally, and your left eye have a direct response while your right eye has a consensual response, which is great. And now for your eyes accommodation, can you please look at the clock behind me and then look at the pen light as I said so. Okay, look at the pen light, look at the clock, look at the pen light. Okay, now, sir, follow the pen light as I move it forward. Okay, so your eye accommodation is good. Your pupils were dilating as you look in the far object, which is the clock, and your pupils were constricting as you look at a near object, which is the pen light. Okay, now, sir, for the accommodation, na your eyes were both converging as the pen light forwards to your nose, which is normal. Now for your peripheral visual field, so can you cover one of your eyes? Just tell me if you see the pen light moving, okay?
Yes.
Okay, do you see it?
Yes.
For the other eye?
Yes. Yes.
Okay, good. So all normal. So now let's proceed to your 6 ocular movements of your eye. So just follow the pen light with your eyes only, okay, sir? Okay, good. Both of your eyes were moving in unison. There's no involuntary movement of the other eye, and that all your eye movement is normal. Now let's check for your corneal light reflex. So just look at me, and I will flash light on you. Okay, as I can see, the light falls directly symmetrical on both of your eyes, which is normal. Now let's do the cover test. So, just look at me. Okay, for the other eye. Okay, good. So as I can see, there's no involuntary movement of the uncovered eye. So both of your eyes were normal. So now let's check for your vision. So I just wanted you to read this first line here. So I'll place this 14 inches within your eyes. So, okay, please read.
Without accessories, a room lacks depth and
Okay, sir. Good. Now can you stand up and let's see your eye vision. Let's use this Snellen chart behind us. Okay, just read the 7 and 8 with your both eyes.
FELO FZD DEF POTEC.
Okay, now cover your right eye. Read the 7 and 8.
FELO PZD DEF POTEC.
Okay, now we cover your left eye. 7 and 8 again.
FELO PZD DETPO FEC.
Okay, now sir, sit down. So as I can see, your vision is 20/20 and it's good. So now sir, let's proceed to your ears. So any family history of loss of hearing? Any drainage? Any ear surgery?
No.
Any ear injury?
No.
Okay, good. So do you feel any pain around your ear?
No.
Okay, good. I will now inspect your ears, sir. So as I can see, both of your ears were symmetrical. They were equal in size. And I don't see any presence of tophi. Okay, good. Now I'll palpate your ears, sir. So as I palpate your ears, do you feel any pain?
No.
Okay, any tenderness?
No.
Okay, none. For your mastoid process, do you feel any pain?
No.
Tenderness? Okay, good. And now, sir, let's check your external ear canal. Okay. Okay. So as I can see, there's no presence of drainage. There's no dryness, no redness. Okay, good. And then let's observe now your tympanic membrane. Okay. Let's check your tympanic membrane with my otoscope. Okay, so both of your tympanic membranes were shiny and they were gray translucent in color. Okay, normal. And then let's proceed to how your ear reacts to my voice. So I will cover your ear and then just say what will I say. Okay, sir? Okay. What
Happy
did I
birthday.
say? Okay. For your other ear.
Happy Valentine's Day.
Okay, so good. Now let's have this watch tick test. So just tell me, where did you hear the watch tick? On your left or on your right ear?
My left.
Okay, good. So now let's proceed to your nose, sir. So I'll be asking you questions again. So any family history of loss of smell?
No.
Any difficulty of breathing using your nose?
No.
Do you have nose bleedings?
No.
Okay, any pain on your nose? Do you have undergone any nose surgery?
No.
Okay, good. Now I will inspect your nose, sir. So as I can see, your nose is in midline. There's no lesions, inflammations, and redness present in your nose. So now, sir, I will palpate your nose. So as I palpate your nose, do you feel any pain?
No.
Okay, as I can see, there's no cartilage or bone displacement. Okay, good. There's no lumps and bumps. Okay, good. And now let's see your patency. So please cover one of your nose and then breathe in, breathe out with your one of your nose. Breathe in, breathe out. Okay, for the other one, breathe in, breathe out. So I can see that there's no nasal obstruction. Then let's now proceed to your nasal cavity. And then can you tilt your head a little bit? Okay, as I can see, there's no inflammation, redness, or swelling, drainage. There's none. Okay, let's check now your nasal septum. Okay, can you tilt again? Okay, as I can see, your nasal septum has no deviation. Okay, good. Now, sir, I will palpate your maxillary and frontal sinuses. Just tell me if it hurts. Does it hurt?
No.
Okay, good. Now, sir, let's proceed to your mouth. Okay. So, any family history of loss of taste?
No.
Any dental surgery?
No.
Any bleeding of gums?
No.
Swelling of the thyroid of your tonsils? Okay, none. So good. So now, sir, I will be inspecting your mouth. So can you pout your lips like you're whistling? Like this? Okay, as I can see, your lips were symmetrical and they were pinkish in color. And now, sir, okay, I'll be inspecting your inner lips and your buccal mucosa. So, can you say Okay. So, I can see that your buccal mucosa is pink in color and your inner lips were also pink in color. There's no sores, there's no bleeding. Okay, good. Now, let's check for your teeth and gums. Can you... Okay. There's no dentures. Can you say There's no teeth, dentures, no teeth cavities, and there's no gum bleeding. Okay. There's no gum bleeding. Okay, good. And now let's check for your... So, as you said a while ago, you have no dentures. Now, let's proceed to your tongue. Can you stick out your tongue? Okay, your tongue is slightly white in color. Okay. And then, can you move your tongue side by side? Up and down. Okay, so your tongue movement is good. There's no involuntary movements of the tongue. And then, can you place your tongue upwards? Okay, as I can see, the base of your tongue is pinkish in color. There's no lesions as well. Okay, there's no inflammations and drainage. Okay, and now let's proceed to your soft and hard palate. Can you say again? And protrude your tongue, like sticking your tongue. Okay. Okay, your hard and soft palate is normal. There's no lesions. Okay. And now let's proceed to your uvula. So can you say again? And then just tilt your head a bit and protrude your tongue. Okay, your uvula is on place. They were in midline. There's no swelling of the uvula. Now for the oropharynx, as well of the oropharynx, they were normal, and your tonsils as well. There's no inflammation of the tonsils. There's no discharge of the tonsils. And now let's move on, sir, to your neck. Oh, any family history of neck stiffness?
No.
Okay, any pain, lumps and bumps in your neck?
None.
Itchiness?
None.
Okay, so now, sir, I will be inspecting your neck. So as I can see, there's no inflammation, redness, rashes, scars, lesions around your neck. So let's check your neck movement. Can you turn side by side and up and down? Okay. So there's no neck stiffness, no pain, no tenderness. Now let's check for your neck muscle. Can you resist the force of my hand? Just turn. Turn your head here and turn your head here. Okay. Shrug your shoulders upwards. Okay. Just resist and shrug. Okay. And your neck muscles is good as well. And then I will palpate your neck for any enlargement of the lymph nodes. So here in your preocular, postocular. So as I palpate, is there any pain?
No.
Okay. Any tenderness?
No.
Okay, good. And then let's palpate your trachea. Can you tilt your head a bit? As I palpate your trachea, do you feel any pain?
No.
Okay, so as I can see, your trachea is in midline. And now for your thyroid gland, any pain, tenderness? Okay, good. So, okay, sir, I think that's it for our assessment today. Before I evaluate you, I will just wash my hands and remove my gloves. I'll be back for a minute. Okay, sir, Leo boy. So, based on my assessment with you, so no asymmetrical features and movements, no involuntary movements of your face, no lumps and bumps around the head, all normal for the eyes, which is good. Pupils equally round and react to light and accommodation. Ears were normal, have no lesions, abnormalities, and discharge. Your nose is also normal, no swelling, the nose is placed in the midline, no deviation of the septum. Your mouth is also normal, no bleeding of gums. You don't use dentures. Your soft and hard palate were good. Your lips were symmetrical and there's no lesions as well. And then for your neck, they were also normal, no enlargement of the lymph nodes, no pain, no abnormalities in your neck movement. There's no lumps, bumps, and swelling. So, okay, sir. So, any concerns now, sir?
No.
Okay. So, if you feel uncomfortable and you have any concerns regarding your head, face, and neck, just don't hesitate to come here and ask. Okay, sir?
Okay.
So I think that's all. Thank you, sir. Stay safe and healthy.
Thank you, nurse.
Okay.